Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College. I'm also principal investigator of Tennessee Community Gauge Alliance Against COVID-19, also known as Tennessee SEAL, and direct and site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, November 14th, 2022. And today I'm going to provide a brief update on the status of the new Omicron subvariants BQ1 and BQ1.1. I will then provide an update on the state of the federal declared COVID public emergency, and then I'm going to provide some tips for treating COVID-19 at home for you and for others, and coping with caregiver stress. I'll follow that up with an update of COVID-19 cases, hospitalizations, and deaths, both nationally and in Tennessee. Public health officials are expecting another COVID surge this winter as people gather more indoors when the virus spreads easier. The future remains uncertain as more immune evasive Omicron subvariants become dominant in the United States. On Friday, BQ1 and BQ1.1 variants officially overtook BA.5, now accounting for an estimated 44% of all new infections nationwide, and nearly 60% in some parts of the country, such as New York and New Jersey, according to the CDC's estimates. BA.5 now accounts for an estimated 30% of all new infections nationwide. Recent laboratory studies indicate that these new mutations in the virus's spike protein make BQ1 and BQ1.1 as much as 7 times more immune evasive than BA.5. So people need to take preventive measures, including getting boosted, wearing a mask in crowded indoor spaces, and increasing indoor ventilation whenever possible. Getting reinfected with the virus still can pose significant risks, both for short-term and long-term complications, including an increased risk of hospitalization, symptoms of long COVID, and even death. The U.S. Department of Health and Human Services did not provide a 60-day notice on Friday, which was a deadline to alert states and healthcare providers if the federal government's planned to lift the declaration of a public health COVID emergency on January 11th. Since the Department of Health and Human Services did not provide notification, the COVID-19 public health emergency will remain in place for at least another 60 days past mid-January. This is really important because the Department of Health and Human Services estimates that as many as 15 million people could lose Medicaid or CHIP benefits once the declaration of the COVID public health emergency is over. This means that persons without insurance may have to bear the full cost of COVID for PPE testing, vaccines, and treatment. Pfizer previously announced that the cost of a vaccine will be approximately $135. This does not include any costs that will be charged for administering the vaccine. I'm now going to talk about self-care measures you can take if you get COVID or if you are caring for someone who gets COVID. Most people who become sick with COVID-19 now will only have mild illness and can get better at home with isolation. Symptoms might last a few days, and people who have the virus should start feeling better in about a week. Treatment, therefore, is aimed at relieving symptoms and includes rest, fluids, and pain relievers. If you're ill with COVID-19, you can help prevent the spread of the virus by 1, staying home from work, school, and public areas unless it's to go to get medical care. Second, avoid using public transportation, ride-sharing services, or taxis. Third, isolating in one room away from your family, others, and pets as much as you can. Eat in your room, open windows to keep air moving. Fans also can help direct air out of windows. If you can't open windows, consider using air filters and turn on exhaust fans in your bathroom and kitchen. You might also consider a portable air cleaner. Use a separate bathroom if you can. Next, avoid shared space in your home as much as you can. When using shared spaces, limit your movements. Make sure your kitchen and other shared spaces have good airflow. Stay at least 6 feet or 2 meters away from your family members. Next, clean, often touched surfaces in your separate room and bathroom, such as doorknobs, light switches, electronic encounters every day. Avoid sharing personal household items such as dishes, towels, bedding, and electronics such as phones. Next, wear the most protective face mask that you'll wear regularly. Fits well and is comfortable when near others or pets. Change the face mask each day. Next, cover your mouth and nose with a tissue or elbow when coughing or sneezing. Then throw away the tissue. Next, wash your hands often with soap and water for at least 20 seconds. If soap and water aren't nearby, use an alcohol-based hand sanitizer that has at least 60% alcohol. And finally, protecting yourself while caring for someone with COVID-19. If you are caring for a sick person and are age 65 or older, or someone who has an existing long-lasting chronic medical condition such as heart or lung disease or diabetes, you should call their healthcare provider as soon as symptoms start, as these factors put people at greater risk of being seriously ill with COVID-19. People with these conditions who get COVID-19 may also be eligible for Paxlovid, a treatment that reduces the effects of COVID. However, these treatments need to start within a few days after symptoms start. Your healthcare provider may suggest use of a home pulse oximeter, especially if you or a sick person has risk factors for severe illness with COVID-19 and COVID-19 symptoms. A pulse oximeter is a plastic clip that attaches to a finger. The device can help check breathing by measuring how much oxygen is in the blood. A reading of less than 92% might increase the need to stay in the hospital. If the provider recommends a pulse oximeter, make sure you understand how to use the device properly. And make sure you know when a reading should prompt a call to the provider. If symptoms seem to be getting worse, call the provider. If you or the person with COVID-19 has emergency warning signs, get medical attention right away. Call 911 or your local emergency number if you notice any emergency signs, including trouble breathing, persistent chest pain or pressures, new confusion, trouble staying awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on skin tone. Ending isolation and quarantine. Isolation is used to separate people with the COVID-19 virus from those who aren't sick. Talk to the healthcare provider about when to end home isolation if you have a weakened immune system. If you think or know you had COVID-19 and had symptoms, the CDC recommends that it's okay to be around others after 1, At least 5 days have passed since your symptoms started. Wear a high quality mask when you're around others for 5 more days. If you have COVID-19 home tests, you can take tests 2 days apart, starting on day 6. If your results are negative on both tests, you can stop masking. If you don't do the home test, wear a mask around others for 10 days. At least 24 hours have passed with no fever without the use of fever-reducing medication on day 6. Other symptoms are improving. Loss of taste and smell might last for weeks or months after recovery, but shouldn't delay ending isolation. These recommendations may vary if you had severe COVID-19 or have a weakened immune system. The CDC recommends waiting until at least day 11 to get together with people who are at high risk of severe illness from COVID-19. And if your symptoms get worse, go back to isolating and talk to your healthcare provider. Most people don't need testing to decide when they can be around others. If you've been exposed to someone with COVID-19, and particularly if you are caring for someone with COVID-19, the CDC recommends that you get tested at least 5 days after being exposed or sooner if you have symptoms. The CDC also recommends that you wear a high quality mask for 10 days while indoors in public areas. Try to stay away from people in your household if you have symptoms. Stay home and in a separate room from others. If you don't have symptoms, you don't need to stay home and away from others. Coping with caregiver stress. As you or your loved ones get better, seek support. Stay connected to others through texts or phones or video calls. Share your worries. Avoid too much COVID-19 news. Rest and focus on fun activities such as reading, watching movies, or playing online games. As you take care of a loved one who is ill with COVID-19, you might feel stressed too. You might worry about your health and the health of the sick person. This can affect your ability to eat, sleep, and focus. And it can worsen long-lasting chronic health problems. It may also increase your use of alcohol, tobacco, or other drugs. If you have a mental health condition such as anxiety or depression, continue with your treatment. Contact your care provider or mental health provider if your condition worsens. To care for yourself, follow these steps. First, keep a daily routine such as taking a shower and getting dressed. Second, take breaks from COVID-19 news and social media. Third, eat healthy meals and drink plenty of fluids. 4, stay physically active. 5, get plenty of sleep. 6, avoid use of drugs, tobacco, and alcohol. 7, stretch, breathe deeply, or meditate. 8, focus on fun activities. 9, connect with others and share how you are doing. And 10, caring for yourself can help you cope with stress. It will also help you be able to support your loved one's recovery. Now I'm going to turn to current COVID-19 trends. Nationally, cases and hospitalizations continue to rise, driven in part by a growing outbreak in the Southwest. Nationally, cases are up 8% over the past 7 days to just under 40,000 per day, or 12 per 100,000 of the population. Hospitalizations are up 3%, and ICU admissions are the same as last week, while deaths are down 10% to 317. The nation's most rapid growth in hospitalizations with the virus is clustered in that region, with Arizona, Colorado, Nevada, and New Mexico, all seeing hospitalization counts increase by more than 30% in the past 2 weeks. Cases in those states are on a similar upward climb, particularly New Mexico. By contrast, daily deaths from the coronavirus are decreasing. Death counts have fallen by 9% nationally in recent weeks to about 325 per day. The number of new reported cases of COVID-19 continue to increase, up 33% in the past 14 days to 1,000 cases per day, or 15 per 100,000, up from 11 per 100,000 2 weeks ago. 17 counties in Tennessee have rates of 25 per 100,000 of the population, or moreover for the past 2 weeks, and the rates of COVID have more than doubled in 22 counties. COVID rates increased in Knox County by 44%, Davidson County by 15%, Hamilton County by 14%, while they decreased by 8% in Shelby County and 13% in Williamson County. Hospitalizations are up 4% statewide to 420 per day, or 6 per 100,000 of the population. Deaths are up as well to over 10 per day, or 0.16 per 100,000. There is little change in community risk level from 2 weeks ago. There are still 2 counties in the red zone, Cocke and Unicoi, both in northeastern Tennessee. In addition, there are 8 counties in the yellow zone, up from 6 2 weeks ago, 7 of which are also in East Tennessee and 1 in Southeast Tennessee. Counties in East Tennessee that are in the yellow zone include Washington, Carter, Sullivan, Greene, Hawkins, Scott, and Monroe. Lincoln County in the south central region of the state along the Alabama border remains in the yellow zone. As colder weather arrives, people spend more time indoors and more holiday celebrations are planned. Concerns mount among local health officials that there will be some uptick in the spread of COVID-19, flu, and RSV in the weeks ahead. That concern is heightened even more because relatively few people across the United States have gotten the updated COVID vaccine booster that is now available for those 5 years of age and older. With Thanksgiving just 2 weeks away, people who are eligible for an updated COVID-19 vaccine booster but still haven't received the shot will need to roll up their sleeves Thursday to get as much protection as possible before the holiday. For now, this is Dr. Paul Juarez from the Tennessee SEAL and HealthWorks at Meharry, wishing you a good day.